Good evening, all. We will discuss today some 3 4 points about epilepsy in pregnancy. Suppose the patient is on treated epilepsy, she has not taken any medications for epilepsy. We have to know there is no associations of with fetal malformations. Very very important. If she doesn't get any treatment, also that will not cause epilepsy during pregnancy. That did not cause any malformations. Okay, but if she is taking some anti-epileptic medications like anti-epileptic medications, what are the anti-epileptic medications, like your valproate, phenytoin. These two medications actually responsible actually these two medications are responsible for fetal malformations. Very very important statement. If they are not getting any treatment, seizure itself does not cause any association with fetal malformation in pregnancy. And what are the seizure frequency that will change in pregnancy? That is seizure frequency, the frequency during pregnancy. We have a three options, three first chances. If you take your total is 100%. Okay, the seizure frequency is on chest. 50% cases of 50% pregnant lady, if they have already seizure epilepsy during previously they diagnosed epilepsy during pregnancy, the seizure frequency in 50% cases it is unchanged. There is no change in the frequency. There will unchanged. The disease progression will not happen. And 30% pregnant lady, if pregnancy with epilepsy, the frequency of seizure will increase. Okay, then rest 20 50 30 20 rule, you can remember 50 30 20 rule. Okay, 20% there will be decreased the seizure frequency. Okay, and seizure risk increase during labor as pain and hyperventilation decrease the threshold. Remember, during seizure will increase, risk will increase during labor because there will be pain and hyperventilations. That will cause decrease the seizure threshold. Okay, then if the epilepsy in pregnancy, she had already get a pregnant lady, she had delivered fine. Okay, now she came with a follow up for contraception counseling. What will give the ideal contraceptive method in a breastfeeding mothers with seizure disorder? What will give? Very very important, DMPA, depot methoxyprogesterone acetate, because depot methoxyprogesterone acetate. Why you will give these drugs? Because progesterone itself increases the seizure threshold. Okay, so as it is increase the seizure threshold, the frequency will decrease if you give a DMPA. Also in a contraceptive method for breastfeeding mothers also. Okay, so basically the seizure only treat if they are not getting any treatment. If there is not getting any treatment, that will not the seizure itself not associate any fetal malformation. If they are specifically taking anti-epileptic drug like valproate, phenytoin, that will responsible fetal malformations. Seizure frequency actually it will 50% there will be on chest, 30% there will be increase, 20% there will be decreased seizure frequency. Seizure risk increase during pregnancy, during labor, as there is pain and hyperventilations that will cause decreased threshold of seizure thresholds. Suppose a pregnant lady, they came after delivery, they came for either contraceptive method. If what are the contraceptive method you will use in the breastfeeding mothers also with seizure disorder, you will use DMPA, depot methoxyprogesterone acetate, as the why the because progesterone increase the seizure threshold, so that will decrease the seizure frequency. Okay, that's overall all about epilepsy in pregnancy. So it's small. Thank you. Please subscribe my channel.